Hello, everyone, and thank you for tuning in to my health and wellness channel. I'm Dr. Gauri Bhede, and I'm a medical oncologist. I've been doing a series on vitamins and minerals that my patients commonly take, and I'm finishing up with trace minerals that our bodies need to consume to carry out our essential metabolic functions. Do refer back to my series for information on all the others. Today, we're going to dive into the medical value of copper. A few years ago, I was wandering through a summer flea market in Australia and I came across this nifty copper bracelet. I had heard that people wear copper jewelry for health benefits, so I decided to buy it. I knew copper pots were really good for cooking because of how copper conducts heat, even though copper pots are easier to cook with and maintain when they are lined with tin or stainless steel. I then came across advertisements for copper containing compression garments. These ads were touting the health benefits of copper, so I started to look at what these health benefits might be and is there any truth to it. First, let us see what copper does for us. Like other trace minerals like zinc, fluoride, or iodine, we need copper in very small trace quantities. The recommended daily allowance for copper is about 340 micrograms for young children, and it rises to 900 micrograms for adults daily. The toxic dose for adults is about 10 milligrams. So there's not a lot of copper we need on a daily basis. But why do we need copper? Copper is part of a number of important enzymes, which makes it important in antioxidant defense, in neurotransmitter synthesis, collagen cross-linking and bone formation, electron transport, thrombosis, and melanin production. How do we get the copper we need? Mostly by eating copper-rich foods like vegetables, beans and lentils, grain, and about 20% from meat and poultry. Contrary to what advocates of copper clothing and jewelry believe, copper is not readily absorbed from the skin. But more on that later. Copper is well absorbed in the small intestine, both passively and actively, and is transported to the liver bound with albumin. The liver then incorporates copper into the main copper transport protein called ceruloplasmin. Ceruloplasmin travels to the target tissue where it binds to its own cell surface receptor, from where it is incorporated into the interior of the cell. Our body maintains its steady state of copper by excreting it in the bile and other gastrointestinal secretions. There are two main inherited disorders of this copper balance. Wilson's disease, in which copper cannot be appropriately excreted and toxic levels accumulate, causing liver damage. The toxic levels are treated by chelating agents and even with zinc tablets because zinc competes with copper for absorption in the small intestine. Menkes disease, on the other hand, is a genetic disorder interfering with normal copper absorption in the intestine, and this leads to copper deficiency. How can you suspect if you are deficient in copper? Deficiency can cause depigmentation of the skin, malformed hair, muscle weakness, and osteoporosis. The lack of copper can mimic iron deficiency anemia, and iron and copper compete for the same absorption pathways. So if the microcytic anemia that is being treated with iron does not improve with the iron supplements, check out the possibility of copper deficiency. If you don't have inherited copper absorption disease, who else can become deficient in copper? People who've had stomach surgery for bypass, where the neurological symptoms can take years to develop and mimic vitamin B12 deficiency. Chronic malabsorption from celiac disease or chronic diarrhea or those on intravenous nutrition are susceptible to copper deficiency, as well as patients on chronic dialysis and preterm infants who are chronically fed on intravenous formula or are on a formula that does not contain the necessary amounts of trace minerals. The opposite problem can occur with acute copper poisoning, and this can happen by accidental consumption by children or by contaminated water sources. It can even happen with the application of copper containing ointments, which can be used for treating burns. This can cause acute abdominal pain, vomiting, and diarrhea. In severe cases, the acute toxicity can even cause heart failure, liver failure, or kidney failure, and even death. So, does a copper bracelet act as an anti-inflammatory treatment? This study was published in this journal in 2013, and 70 patients were enrolled. They had painful rheumatoid arthritis and were randomly allocated to wear 4 different devices for 5 weeks each, with a 1-week washout period in between each device. These devices were a standardized magnetized wrist strap, a demagnetized wrist strap, a attenuated magnetized wrist strap, and a copper bracelet. The outcome was measured by using 2 different pain scales and blood tests for inflammation like C-reactive protein, in addition to a swollen joint count and other assessment of disease activity. Analysis of the treatment outcome did not reveal any statistically significant difference between the 4 devices in terms of their effect on pain, on inflammation, on disease activity, or even the medication use for their rheumatoid arthritis. Another analysis of the copper-infused compression garments was conducted by Consumer Reports, because these were sold as consumer goods, not medical devices. This did not find any reliable scientific evidence to support the claims of the manufacturer, and that manufacturer agreed to pay a $1.35 million fine to settle the charge from the Federal Trade Commission of Deceptive Advertising. Copper bracelets and other wearable copper products have been marketed as providing benefit for inflammatory arthritis, but there is no scientific proof that there's any skin absorption nor any proof of efficacy. But if it makes you feel better anyway, at least you're not going to get copper toxicity from wearing that copper bracelet. And I wear this from time to time because I like the look. I hope you found this information useful. Do subscribe to my channel for more interesting and useful information coming your way. Take care and be in good health.